Good afternoon and welcome to the Donna NP Show, a series dedicated to explore healthcare issues and challenges confronting health professionals. Today's discussion will be on perspectives on healthcare. Is healthcare a privilege or a right? We live under the premise that we are one nation with equal rights to live in a society that can provide us all with the basic skill sets that can allow us to survive, including food, shelter, healthcare, and housing. As rudimentary as this may be, it is true. We believe that we all have equal access to healthcare, education, and employment opportunities to support these basic rights. However, in many areas of our country, we have come to recognize that this is not the case. In fact, the growing isolation, indifference, and inequality that come with one's socioeconomic, ethnic, or racial status is a pervasive reminder to all of us that we are further divided in our efforts to provide adequate care within these identified groups. The disparities that exist for immigrants, children, elderly, mentally ill, and the uninsured equally contribute to the difficulties to adequately appropriate and allocate resources for these individuals who require our assistance. Although we are attempting to translate our practice into policy change, as evidenced by the State Children's Health Insurance Program, it clearly is not enough. As a nation, we fail to reach out and adequately provide the fundamental basics, including healthcare services, social and housing programs, and education opportunities, among others, to a deserving population so that they may function well within a society and contribute productively. This has been well recognized following the aftermath of Hurricane Katrina, and yet continues to be an unresolved issue. The complexities involved in the processes to align government support on local, state, and federal levels contribute to the fragmentation and inability to provide appropriate access for a multitude of services that the population needs. The ineffective communication among these branches of government further impact the ability to address the concerns of the nation despite acknowledging they exist. This has been validated by closures of state-county hospitals that had traditionally provided access to health care, among a number of other valuable services. County hospital closures have caused the displacement of those individuals that would have otherwise obtained them and now are left without access. Equally, the unwillingness of primary care providers to accept new patients that are unfunded or enrolled in managed health and capitation plans are reducing their access to health services with increasing levity. This is primarily in response to the growing control that insurance companies have over contracting primary care providers. The lack of adequate financial reimbursement from the insurance companies to the primary care provider who is managing the care is inequitable to the care provided. Additionally, the government has reduced reimbursement for primary care provider services, impacting the future viability of primary health care within the United States. As a result, patients are left with limited options for available access to affordable health care and ultimately use the emergency department to receive it. Oftentimes, patients with non-emergent problems must gain access to complex systems that are designed around the conventional model of practice and do not support the patient's needs or preferences that contribute to the overuse and underuse of healthcare resources. As an emergency department nurse practitioner, I experience this firsthand in my daily practice. We are ground zero for a multitude of healthcare and economic disparities witnessed in our management of patient care. There are countless visits by patients who are unfunded, immigrants, mentally ill or homeless, and each group shares the same story. They have no access to healthcare services, housing, or the ability to obtain services or timely care elsewhere. There are few, if any, services to educate them on how to connect the dots to obtain the services they need and thus use the emergency department as their safety net. They do not understand what appropriateness involves in obtaining the proper level of care, and this is often complicated by what they want versus what is medically indicated. In addition to our roles as emergency health providers, we have also assumed responsibility to become the nation's social service department as well. It takes weeks to obtain appointments with primary care doctors, mental health specialists, or state-funded programs to assist them with their needs. The untimely delays in access to health care and preventative services increase their risk for injury or illness. Often we find these patients back in the emergency department only to manage a more serious condition that adds to the escalating cost of health care when a preventable condition initially existed. Legislation and regulation to allow universal primary care provider status for nurse practitioners is a critical component for healthcare policy in reducing barriers to access. Nurse practitioners are competently trained in the management of primary and preventative health care and are the solution to many of the access issues we are presently experiencing. Additionally, there have been a number of research studies that have concluded that the use of non-physician providers have shown minimal differences in the outcomes and satisfaction of patients receiving primary care and preventative health services. Advances in technology are making it possible to reach those that are underserved and provide access to health care by alternative delivery systems. Although the science needs to catch up with the technology, telemedicine has shown some promise for medical diagnosis and health care. In the meta-analysis conducted by Curell et al. In 2007, 7 trials involving more than 800 people were evaluated using video consultations from the emergency department, primary care offices, hospital outpatient departments, and home care. Although the patient numbers were small, none of the studies demonstrated any ill effects from the interventions. Despite the patients reporting they were satisfied with their experience, the study did not show unequivocal benefits from the interventions or the evidence of safety in telemedicine. However, they conclude that the feasibility of telemedicine is promising, but that there has not been enough research in this area to show the effects on health outcomes, including the cost of using this technology. Our challenges as advanced practice nurses are many. However, collectively we can influence our communities, professional colleagues, regulatory bodies, and legislative agencies to act in the best interest of our patients and advocate for those changes necessary to improve their outcomes. Thank you for your attention, and I look forward to our next session.